All right, welcome to Prosperity in Practice, real conversations at the intersection of pets, people, and prosperity, where we close the gap between what pet parents feel, what veterinarians know, and what better outcomes actually require. I'm Dr. Owens. This conversation is about the tension pet parents feel when they want help fast and the reality veterinarians face when medicine, communication, workflow, and access don't always move at the same speed. All right, so today, special guest. I'm joined by Dr. Shadi Ireifej, a veterinarian and innovator known for his work in access to care, triage, and helping pet owners make better decisions when time, fear, and uncertainty collide. Let's get into the conversation. All right, Doc, look here.
Yes, sir.
You are a board-certified surgeon. Let's start with that because that is a huge accolade that not every veterinarian can sit on ever. So please introduce yourself. Please
Thank you.
let the people know what I missed and please give them all the accolades.
Sure. So I'm Dr. Ireifej, a board-certified small animal surgeon. I graduated from Cornell University in 2006. From there, I did my general internship at Angel Animal Medical Center in Boston, Massachusetts. And then from there, I spent the next 2 years with my surgical internships and then a 3-year residency after that at Long Island Veterinary Specialists in New York. That's where I met my mentor, one of my best friends, Dr. Dominic Marino, taught me everything, not just about surgery, business, team management, client communications, all the pearls of wisdom that you don't really get in vet school.
Yeah.
From there, I moved out to Las Vegas, here in town. I operated at the specialty center for just under a year. After that, Silicon Valley. I managed 3 hospitals there. I was on call 24/7 for all 3 facilities. After that, I went to Studio City in LA, and I was part owner of a hospital where they originally were just nights and weekends. We converted to a 24/7 multi-specialty ER hospital. So I managed surgery, internal medicine, and oncology there, grew that. And then from there transitioned over to virtual care where I operate vet triage full time.
That is amazing. And what made you want to make that full commitment to that pivot with all these other accolades under your belt?
The profession has been struggling for a while, decades. We have a huge problem with culture, work-life balance, compassion fatigue, all the things that are all too familiar with us in the veterinary space. And that was affecting me too. Even in the fairly nice environment of specialty care where I have all the toys, all the brain power that I could ever ask for and clients who are dedicated, I was still feeling the burnout and that I could do more with this. And the idea with virtual care actually came to me 2007, 2008, where I realized that the receptionists were spending too much time on the phone with clients who are asking, should I come in? Is this an emergency? And at a 24/7 hospital, they're taking 100 calls a day. So I thought, what if you had a business model where doctors can get paid to triage on the phone? And back then, all we had was Skype. There wasn't really much for virtual access. So that idea grew over time. I was working on it in the background. And then finally, I hit a juncture in my career where it's like, I want to change. I have this amazing idea. No one's done it before. I think it can be done. They did it in the human medicine. Let's dive into it. So it just so happened that one of my best friends also, he handles all the marketing, the tech side, the financial side.
Yeah.
So I thought, what a better team up. I'll handle the medical. And so and we're both kind of entrepreneurs.
Yeah.
So from there, pivoted completely. Despite my energy for it now, it was terrifying. Changing not careers, but changing a major part of the veterinary industry that affected your life for so long, all those years of education, to then go to something very different was scary, but it was needed. Not just for me, but for the pet community and for the veterinary industry. So here we are, many years later, operating vet triage successfully.
Amazing. Congratulations, Doc.
Thank you.
And
Thank you.
I'm very proud of you for even understanding the necessity of pivoting for your own mental health and well-being, because that's important. I'm sure you are a star in that very niche, low percentage amount of board certifications that come with veterinary medicine. You still decide to pivot. That's amazing.
Thank you.
So we'll get right into it. As you can see, Dr. Shadi is very, very well-versed, and his insight is invaluable to what we're going to bring to the table today. So starting off, number one, Doc, what do you think about pet parents being uninformed and are, vets communicating poorly because of this misinformation?
You only have 4 years in vet school to learn all the things you need to learn.
Right.
And some of that information you're not going to use after you graduate. Unfortunately, the majority of vet schools, although this is changing, they're not focusing on business attributes, they're not focusing on client communication. And so we have to learn that after veterinary school is completed through your internship, residency, or your first job, whatever it may be. And I do think that it's the veterinarian's responsibility to adequately educate clients. We all know about Dr. Google. Clients have been using the internet forever, and we shouldn't be opposed to it, but we ought to be the foundation, the gold standard of information for our clients. We ought to know.
Sure.
That's what we're trained for. So not only realizing that and believing in yourself, but being able to communicate it in a way that fits that client's world, because they're coming from a different financial background, ethnic background, cultural background. Love for animals is on a spectrum too, right? So I'm going to put the onus on the veterinary community that if a client is misinformed or they're relying on internet sources to get their information, we're dropping the ball. So I think that's really where the information should come from as veterinarians. That's not to say that veterinarians know everything.
Yeah.
No one person can, but we have teams. You've got phone a friend. Yeah. You have your own veterinary resources you can use to get information when you're not completely sure, but give that client the information as point blank as you can, with also a sensitive blanket around it.
Correct. And I mean, it's a very emotionally charged situation a lot of times, but I don't think also the pet parents understand the pressures that we deal with trying to communicate and figure out mentally what's kind of your top 5 differentials of what's happening with this pet, and trying to secure exactly the best resources for the pet parent for a treatment plan that may or may not come to fruition because of the financial burdens. Do you think pet parents understand that pressure that we deal with? Like, not trying to make an excuse for us, but do they understand it?
No, I don't think that they do. And also, I don't know if it's their problem. You want to get to the point where if you're an experienced physician, that everything you do, whether it's skill-based, knowledge-based, communication-based, it's muscle memory. You want to get to the point where you're so good at what you do at every aspect that you don't even feel the pressure anymore. And the client, maybe they should care, maybe they shouldn't, but I don't know if it's their problem, you know? So that growth process, though, to make it where everything's muscle memory is painful. So so you have that window where you're going to be doing some growing, and it's not going to be fun.
But you got to just dive in and rip that Band-Aid off so that we're well-versed as a foundational platform and not a rocky one that was never stable from the get-go. So
correct.
I completely agree. I mean, we are the professionals in this, and I do believe a lot of veterinarians need to step it up. When it comes to, hey, I am the advocate for the pet, even if you got the finances or not, I have to say what I have to say and then let you make the best decision for the pet, because that's all I got. And the pet can't talk, right?
Perfect.
So I think that's very well said, Doc. What do you think about social media, man? Like, has it made pet care smarter or just like rah-rah, just super loud?
Boy, you can argue both sides of this. And so probably both the good and the bad are equally there. I would never say dispense with it, just get rid of social media, it's all bad. It's not. For example, feline infectious peritonitis in cats, FIP. All the black market underground drugs for that. That drug, at least from my perspective, came to the surface of veterinary medicine through where now we're seeing literature on it, because people on social media were sharing this drug and saying, try this, because these cats have a death sentence anyway, right? And now all of a sudden you're seeing papers on it. So social media can do some profound things when it comes to animal advocacy. It's also a source of Joe Schmo giving you medical advice, where in the virtual world, it's one of the points I bring to medical boards and organizations that are skeptical of virtual care, where I tell them, what do you prefer? You want them talking to some unknown person online, or do you want them talking to actual veterinarian, right? It's an obvious question. So social media in itself has both good and bad to it. We're not getting rid of it. It's here to stay. And now with artificial intelligence, and who knows what the next step is, it's going to become more potent for us. I think that even though veterinarians a lot of times will use Dr. Google as an example of what clients should not do, because it's always here, find a way to work with it. So I remember, I'm old enough to remember when the internet first came out, and clients would come to your office at the vet clinic with a stack of papers they printed from web crawler or Yahoo, right? And all the research they did. I never told them, nope, ignore all that. I'm the boss. No, let me look. Look at it. Okay, here's why this is inaccurate. Here's why this doesn't apply to your pet. And you work with them as a team, as opposed to having animosity towards the social media platforms. So it's here to stay. Find a way in your practice to make it work. But you hope that clients will trust you fundamentally. And that's what our job is, to convince them of that.
I mean, but what do they get right? If you had to say something, outside of the FIP forcing the academia side of things to get the research out there, what else do they get right? Because, there's a lot of wrong and misinformation. I think it's just so the loudest ones speak the loudest because they have the highest influence, right? 5 million followers. What percentage of those followers are watching you feed your 5 pound Chihuahua filet mignon, grilled steak and putting little toppings of garlic on it? Like, what are they getting right though? You know what I mean?
I don't want them relying on, I don't want a pet owner relying on social media for all their veterinary advice. There's a reason why we exist. There's a reason why we go through so much high education to be in the position that we're in. But for clients who are looking for an outside source of veterinary information, you have to hope that before they implement anything, they're going to run it by an expert, which is you and I and others in our field. So it's a way, you have to find a way to work with it. That being said, because I work in the virtual world, one of the places that I've seen this shine is difficulty with access to care. If you live in a rural area, whether it's in the States or international, one part of social media that I do like that I've seen is clients will share what ER hospital is doing what at one time, who's at capacity, who isn't. Or, hey, if you take the ferry, there's a hospital across the water. I've got stories for you, right? But at least it gives clients who have literally no option, especially in an emergency, a way to find out who's doing what in town. There are some areas in the US where a veterinarian will visit for like a week every month, and that's their vet for that week, and then no more until next month. So social media does help in that regard. But so there can be some positives to it. I just want clients to understand, like, just like your own medical doctor, the buck has to stop somewhere, and it should be at the professional.
Please. I agree. Well said, Doc. Do you think vets are asking for compliance or asking people to spend money where they never had prepared to spend it? What do you think about that?
Well, we know the problem in compliance, and it's not just a problem in our field, it's a problem in the human medicine side as well. Compliance is a big problem. I do tend to see that in terms of compliance. Let's say you're the pet owner and you're on medication, and so is your dog. Guarantee you're going to give your dog the medication first before you. We see that. So at least there's that hierarchy. I'm not saying it's good, but at least the animals tend to like come first. You know, it's like treating your child before you treat yourself. You know, so okay, fine. And I don't know if anybody has the answer to fixing compliance. I don't know. As well versed as you and I are in the profession, not just medically, but also in terms of client communication, you and I both don't have 100% compliance with our clients. It's impossible to fix. So you do the best you can. The veterinarian ought to emphasize why it is important that the pet owner should comply with these things. If it comes down to finances, you know, let's say, because the second part of your question is regard to finances, well, maybe if that client is giving you the red flags that they're not going to be as compliant as they should, well, here's what's going to happen if you don't do what I ask you to do. It may not happen tomorrow or next week, but 3 months from now, I'm going to be asking you for a referral to CT or MRI, which will cost you thousands of dollars if you don't follow my advice right now. So we have to be able to, I don't want to use scare tactics, but it's just a medical reality where if you don't treat the disease gets worse. So why don't you do what I ask you to do for the sake of your pet and your wallet, if that's a concern to you, and then you'll see what the outcome is.
I think, to your point too, Doc, like we get nothing out of telling you we told you so. The pet sufferers who can't talk, we just see it so often. It's like, man, the chances are high, 40%, 60%. It's going to happen if you don't do it. You don't want to do a parvo shot. You're bringing them out, walking the dog under 16 weeks, but no parvo shot, don't matter. They're going to get parvo. Maybe not today, maybe not tomorrow. They're going to get it. And what do I get from that? Nothing. Right? And that's a super preventive conversation. So like, I mean, the compliance, I believe, starts with when you get him as the pup or before you even get him for the consult. Hey, what kind of breed should I get? What kind of dog should I get? Maybe you shouldn't get a dog. Maybe we should just start with a pet rock, right? And then pretend it's a dog, and then we can do what we want with it. And then we can follow up and say, hey, I actually had to go out of town for 2 weeks and I had no finances to think of anyone. If this was a real dog, this dog would have just been neglected. Like, exactly, just not today. And we all want that human-animal bond, but I believe we don't consider the animal-human bond, right? Because I had to reverse that because you're not considering the animal's needs and necessities outside of food, water, and some sunlight and a comfortable bed. They're not a plant, right? And I think that is just a key part of the compliance. If I know what I'm getting when I purchase a vehicle, I have to get vehicle insurance, right? I have to get, maintenance on it. I have to make sure I am structured to not have a DUI,
Yep.
right?
Yeah.
And have those set up so that I'm safe, and then change the tires. So if you never issue out any compliance, any maintenance package for this pet that you want to get, you're guaranteed to fail.
Absolutely. I've had this conversation many times, both privately and publicly, where if you're in the lifestyle looking for a pet, maybe it's your first pet, whatever, and dogs we know come in all shapes and sizes.
Yep.
If you're not an active person, don't get a retriever who needs to like hunt and run and be active, right? If you're gonna live in some hot or humid area, maybe a brachycephalic is not for you, right? Maybe you shouldn't get a husky or a Malamute when you live in Las Vegas, right? Like, think of your lifestyle and what that dog needs before you decide to jump in. Otherwise, yeah, every single problem that comes by is gonna be a headache for you. And you're gonna start to sacrifice things, and unfortunately, the sacrifice will be on the pet.
Yeah. And I think that's why I don't have a Ferrari, because I can't afford the maintenance of a Ferrari. But the people who have Ferraris, I'm sure, say, hey, I don't mind spending $8,000 to $10,000 for an oil change. That comes with the territory, and I understand. Therefore, I am compliant, right? So, excellent. I do want to follow up. Like, what do you think hospitals should do as far as recommendations so that the trust doesn't get lost between, the pet parent and the veterinary clinic, so that the pet can actually thrive in spaces? Like, what are they not doing? What do you think they should be doing?
There's definitely multiple facets to that. The first thought I had when you were asking the question was, as always, clear client communication, setting down expectations. We need to give clients all the options that are viable for that case, pros and cons, not just expenses, but pros and cons of each. Communicate with them the importance, and you need to say it without saying it, that you are an advocate for the animal. This list of stuff that I'm recommending to you is not just so I can afford that Ferrari.
Right.
It's so because your pet needs this. And then a second tier to that, outside of client communication, is strong medical skills from our professions. Our professionals, our doctors need to be able to read radiographs themselves, not just wait for the radiology report. Or when the radiology report comes in, does it look right to you? Do you agree with their assessment? Just because they're a specialist doesn't mean they're always right.
Right.
How strong are you diagnostically as a veterinarian or surgically, however you run your practice? But do you have strong doctors that are confident in their, or are they giving every animal an injection of antibiotics and steroids because it's easy and quick, and you don't have to challenge yourself as a clinician to be able to actually work the pet up and have difficult conversations with that client? So I think hospitals in general, whether you're talking about the doctor, the medical director, the CMO, all the way to the receptionist, the assistant technician, everybody has to be on the same page that we are not only trying to run a wonderful veterinary facility, it's also a business that needs to thrive. And we only do that through good, honest medicine. And that's nothing weird or underhanded or shady. It's all transparent to the front. That will resonate. Clients will feel that on every level, from the front desk, hell, from the parking lot to the time they see the doctor and then back out the door. They should feel it every step of the way. This place is genuine and has their best interest in mind. So if you can cultivate good communication and strong medical skills with your professionals in that building, hopefully you're good to go.
I love that. And I believe also in those facilities, you'll see multiple tiers of education, from the phone call. Hey, bring the stool sample, have that conversation, heartworm testing, you prepping that client. And they come in, and then they say the same thing again. And then the veterinary assistant says the same thing. And then the veterinary technician says the same thing. And then the doctor on the third or fourth or fifth tier, they say the same thing. It's like, man, the client says this must be important. I think I'll probably do it. I guess you really do care. And then you give results. And then you have the community and a culture that's really gravitated on best care for your pet. And you understand that comes at a reasonable cost, but we're keeping the cost down because we're not prepping for the emergency. We're prepping for prevention and longevity and quality of life. And I believe that is something that we are missing in the field, especially in this area. I call it the 80-20 rule. I believe 80%, in my experience, are practicing below gold standard, but even gold standard based off of the board, our Nevada State Board, it's a slippery slope, So that can also make us feel as veterinarians a little gun shy when it comes to offering the best care, because we feel that the client's going to do X, Y, or Z, or repercussions when things don't go the way we all want them to go, on a budget that we may or may not have, on a circumstance that we're very out of our control, and all we can do is try. So I think those factors also play a role in this, but I'm so glad we have doctors like you that do exist, and it is a bright spot. And that's, I mean, I'm being very honest. We really appreciate that because I feel like it's just not enough of us.
I agree, and I don't know why that is. I'm always ready to blame whether it's veterinary school education or whether it's lack of mentorship once they graduate. But there's reasons why you and I feel like we're in the minority on this front. I would like to tackle the gold standard aspect because it seems that over the years, or maybe this is due to poor training or lack of mentorship, whatever it may be, gold standard has become synonymous with medical monotheism, where it's like, if it's not gold standard, get out of my door. And I wish the world operated in a way where you offer the best to every client and they all say yes, and everything turns out the way you want it to. But it's not the way it is. The problem is if you're an inexperienced doctor and you're not comfortable living in that gray area of like, well, negotiating with the client, what they can afford, what they're willing to do, gold standard becomes the only standard you have, which is fine. You can run your practice that way if you'd like to. It may be that 80% of the clients are not for you for that practice. But don't, for the new vets, don't confuse gold standard with medical monotheism. That's not the only way. It's the best way. It's gold standard, but it's not the only way. And we have to learn how to be able to contend with that depending on how you want to run your practice.
Correct.
If you want to service the 80% as a majority, so be it. Realize that there's a gold standard. Yeah. And if you're looking to only focus on 20%, great. Other clients will have to seek their veterinary care somewhere else. But I don't want young veterinarians, especially, I should say young, new veterinarians, think that gold standard is the only standard.
Right. But I mean, I think you just have to have somewhere to shoot for, because if you don't know what best care looks like, you're always going to be stuck in a rut. When the masses are like the 80% that are practicing, like, hey, whatever the client wants, let me appease the client in the Google Yelp review, and then the pet suffers. And that's what I see owning ER. I see everybody's dirty laundry, so I know who's doing this, and it's very unfortunate when you see the client say, "How come my vet didn't do this or that?" And we could avoid this entire 2 a.m. conversation if they would have just, and without throwing them under the bus. It's like, I know the answer to that, but I also wasn't in the room when the conversation was had, or maybe it wasn't had. And of course, nobody ever wants to be the villain in their story, so you got to blame somebody. And it's not my job as a profession to throw you under the bus and vice versa, because I wouldn't want that either when the client's playing mommy and daddy against each other to appease their own feelings. But at the end of the day, we have to focus on the animal who can't talk and has been suffering.
To me,
that's always a challenge.
I hear about that. What I hear from what you're saying is medical record keeping.
Okay, there we go.
Document what actually happened.
Yeah.
If I gave the client 3 different options, and they chose the less than ideal third option.
Decline, approved.
Thank you. At least do that.
AMA.
At least do that,
Please,
right?
Yes.
Ideally, even expand on why is declining these 2 options bad?
Yeah.
What can happen? What did you tell them, right? So when a client tries to have me pin up against you, and then I send you my records, and you think, well, actually, Ms. Jones, Dr. Ireifej recommended X, Y, and Z. You declined it, and he warned you.
Yeah. On October 2nd. 2 years ago,
and
then 3 years ago.
And then all of a sudden that client will remember the truth, right?
Selective amnesia.
Yeah, and it's one of the reasons why people get in trouble with medical boards. 80% of medical board violations are because of poor communication documented in the medical record. If you didn't write it down, it didn't happen.
Yeah.
So that's a very important point that you're bringing up.
And we're calling that CYA. For those who aren't familiar, it's cover your ass, right? Because if not, the joke's on you, but mainly the pet. But it doesn't make us feel good when we're really trying to do our best for the pet and still get short-ended on all fronts. We read those reviews. Unfortunately, it don't feel good. Everything doesn't go our way. We want the best care. We want the best options. And again, to your point with gold standard, yes, we know everybody realistically can't afford it, but if I don't even bring it up as an option, it is my duty, like any other professional, to say these are your options. I'm not going to short you because I either didn't know about gold standard or refuse to entertain gold standard with a client that you have no idea what they're capable of financially or emotionally. So I do agree with that, and I do appreciate that. Final question, Doc. With everything you've seen in triage and access to care, do you believe the system is broken or these continued expectations are broken?
Oh, it's definitely both. It is definitely both. There's no way to get around it because you can have, so the system, meaning where my mind goes with that is I have to discuss with medical boards and veterinary organizations constantly about how it is that I'm operating virtually is okay, because their rules and regulations go against what I'm trying to do with virtual care. I believe they're antiquated, they're outdated, they're old, they're not progressive, and they've been that way forever. And Veterinary is not a new company, and they still haven't updated their rules and regulations yet.
Strong point.
So the system itself, right off the bat, is a problem.
Yeah.
They seem to be more advocates for clients who complain than the actual veterinarians who are who have the target on our forehead.
And who's on the board, by the way? I didn't mean to interrupt you. Are they veterinarians or just regular civilian?
Oh, it depends on the medical board. Some have seats that are open to the public, so a pet owner. Some don't. But usually when I'm talking to them, they're veterinarians. And sometimes it's one person who's representing the whole organization. Sometimes it's an entire table, a conference room table full of people on a Zoom call. And I'll contend with anybody that wants to talk about it because our numbers are strong, right? Our track record is amazing. So try and convince me that what I'm doing is wrong when I have almost 250,000 clients, happy as could be with virtual care, right? So you can't compete with that, but that means the system is broken.
Right.
If we don't have medical boards that aren't going to listen to pioneers in the field,
stuck.
How can I help you?
Dead in the water.
You know, I won't mention the board. I had a conversation with them last week, not in the U.S., and they didn't realize that I had just recently published in February the largest telehealth, teletriage, teleadvice paper in our industry so far, over 1,500 dogs. And she was trying to tell me why it is they believe their rules and regulations are correct. And I said, do you understand that goes against the largest paper just published 2 months ago? Oh, let me think who the author was. Oh, that was me. Are you saying you guys don't create rules and regulations based on medical literature? Really? That's kind of the opposite of how veterinary medicine operates, isn't it? So the point is saying that the system is definitely broken, but client communications absolutely is a problem. I've worked in all the litigious areas, New York and California, right? They are ready to throw you under the bus the second they think you did them wrong. And so when clients come into your office already combative or believing a certain way or they know best or whatever it may be, you're already getting off the wrong foot now. Because now I have to protect myself. Now I'm in defense mode as opposed to being on your side to try and target this disease in your pet. Now I have to protect my own license. That's not a good relationship to have.
Lifestyle, way of living. I mean, it's us versus the problem.
Right.
Problem's in your dog, not at your dog or your cat. It's the problem within it. So
absolutely.
Crazy. That is huge insight. What does the future look like for us? Like, how do we get better? We understand both sides of the fence have some challenges, but what do you suggest? Like, what would be your best step moving forward? If you had it your way, what would you do?
So it'd be multiple levels. You have to attack at multiple levels. First is the elementary school, high school student, undergrad who's thinking about being a veterinarian. Tell them about how it is. I'm not saying be doom and gloom. Tell them how it is. You are dealing with people way more than animals.
Period.
Right? And so set the expectation there. Then veterinary schools. We have more veterinary schools now than ever in our history. However, the majority of the new ones have a distributive model where students have to go somewhere else for their 3rd and 4th year clinical rotations. Well, that's good and bad, right? And so we need to try, and also bigger classes, which means less one-on-one. So we need to try and figure out with vet schools, how can we teach them what they need to know, but also get them ready for the real world? After that, internships. I think it should be mandatory. 1 year general internship at a practice that will use you more than just a receptionist, right?
Or holder.
Seeing cases on your own with feedback and mentorship, and then from there, you're pretty well set. I think that all of that at bare minimum needs to be handled, and it's at every single level. It's not an easy fix at all. We have vets that are old school, just super experienced veterinarians, and they're going away. And we're seeing younger vets retiring earlier and earlier every year, and this is multiplied in the equine world.
Oof.
It's even worse. There's less of them, and they're retiring earlier and earlier. So anyway, all that to say that if I had it my way, you would see each step in the new veterinarian's life and tackle each one. There's no other way of doing this.
Are we attracting the right type of talent?
So I got massacred for this at a conference because they asked this, and I'm not shy. I'll raise my hand and put out some idea. We oftentimes blame compassion fatigue and suicide, high turnover, and we say the profession's killing these vets. Sure, maybe, fair enough. We can point to all those problems. is there a world where we have a way of screening veterinary applicants to see, do we know the behavior personality profile of the veterinarian who is most likely to succumb to work stress and compassion fatigue? And if we know that profile, can we screen them before they get into vet school? Now, there's a whole host of ethical problems with that.
I know.
But
Yeah.
if you were to find a objective way, a non-discriminatory way of doing that, you almost wonder, what defines a successful veterinarian? Can you extract from that what the buildup of a veterinarian is?
Right.
And then ask for students or accept students at the vet school that fit that bill. Not just GPA, not just letters of recommendations, not just all that stuff, but like your actual, like, do you fit the bill? Are you more likely to have a problem emotionally, mentally, spiritually, whatever, once you get into the profession? Because if you are, maybe this is not the right profession for you. But it's not all on them.
Yeah.
The profession too, as we've been talking about this entire time, has its own challenges, right? But I wonder, if there's a way of doing that. And then, with artificial intelligence, being able to screen huge amounts of data points to come to a conclusion, you almost wonder if it can be applied to this. So I don't know. I don't know, but I'd like to. I know you can see how I got pilloried for this notion. But
got to talk about it.
I'm not leaving it alone. Yeah. I think there's something to be said about it.
I think you have to talk about it. And I appreciate that. I mean, we talked about a lot today. I got last couple rapid fire questions for you.
Please.
And then we'll close. But man, that insight is very insightful and refreshing, because we do need to have these conversations more to promote change. For especially, the kids that want to be a vet. How many clients you say, I wanted to be a vet when I was a kid?
It's so common.
90%,
right?
90%. My massage therapist was like, I wanted to be a vet when I grew up, and then I got my first puppy, and I had to I'm like, yeah. So, but you don't know the reality of it. And why do they join it? Because they love animals, not so much humans. Mm-hmm. And then you realize, to your point, shit, I got to talk to people all day, but a pet can't talk.
Unless you're looking to go into like pure shelter rescue medicine or wildlife.
That can be dark.
You're dealing with people. And you and I, it seems very obvious, we love people. We love communicating. We love interacting. We love that stuff.
Correct.
So it makes our job kind of easy.
Yeah.
But yeah, if you have a real animosity towards person-to-person interaction, especially if you have to talk about fairly heavy subjects like, is it time, or your dog needs an MRI, an emergency spine surgery.
Abuse and neglect, just in general.
All that stuff. Yeah. You have to be able to enjoy talking to people and having those conversations. Yeah. And not everybody's built for that.
Period. And it is what it is, Excellent, Doc. All right, here we go. One thing pet parents need to stop doing immediately. Just one. Just give me one.
Just one. Yeah. Boy. So much for rapid fire. I have so many things on my mind for this.
We're going to come back. I'm going to bring you back on this.
Yeah, boy, oh boy. Well, I think in tune to what we've already spoken about, I think stop going to online sources that are just not vetted. It's not primary resources. Stop going online and listening to all this stuff. Stop doing your own research. Now, I'm saying that because pet owners explain doing their own research in a way that makes it seem similar to like a scientist or a clinician who's actually researching stuff. Searching things up online is not research. Research is collecting data, performing statistical analysis on it, publishing a paper. That's research. That's
removing the outliers.
all that.
Right.
Outliers, biases, all these things. So, I don't know what you want to call it, but it's certainly not research, Miss Jones. So, stop going online and following all these things, going down these rabbit holes, and you're going to get frustrated and confused and angry and sad and anxious for no reason when you can talk to your friendly neighborhood veterinarian who's happy to give you the information that they know so well.
Not a Spider-Man quote. I love it. All right, Doc. One thing veterinarians need to do better right now.
Oh man.
Too deep.
I love it. I love it.
Give it to him, Doc. Give it to him. They need to know.
I think that veterinarians right now ought to they need to self-critique.
Accountability.
Accountability.
Okay.
Look, if you have a mountain of clients that aren't doing what you said, or they're transferring their records somewhere, or they keep getting second opinions, or they're going online, or you need to look at yourself. You can blame the clients all you want, and sure, they have their own frustrations, as we've expressed. But what are you doing wrong as a veterinarian to not get these clients on your side? Why aren't they not worshiping you?
Come on.
Right? So some introspective analysis would be great, whether that's through mentorship, whether it's through conferences, talking to a bunch of people who are more experienced than you, specialist or not, doesn't matter. Folks that have years under their belt, find out what you could be doing better.
Sure.
It's so easy for us to think, oh, no, all my clients love me. But you don't realize that 60% of them went somewhere else over the past year. Yeah, you're busy, but why'd you lose those 60%?
Right, it's a lot.
It's a lot. And you'll never know it because who's going to tell you? We have no way of keeping track of these metrics. So look inside, really self-critique yourself, and then implement changes. And it will be painful.
The growth is painful. That self-audit is important. All right, biggest myth in pet care today?
That the vet only wants the money. Yes, veterinarians can have a lucrative career, absolutely, as they should. Well-deserved. Hard work, lots of education, medical debt, all the things.
Yeah.
We should make an income. This is not, it's not pro bono work. But we need to stop thinking of veterinarians as people who just want to drain your wallet or your bank account. They're doing the best they can. They're trying to offer you the best that's available to you, to them. And they're not thinking about the dollars. I can promise you, I have trained many interns and residents over the years. Yeah. I've had many externs come through. And now with Vet Triage Pro, we have telementorship, right? We are helping guide veterinarians through cases. Not a single time does the aspect of money come up until they talk to you, the pet owner.
Right.
The veterinarian is thinking, what do I need to do for this pet? Because I don't know. And then your colleague who's more experienced will say, oh, you need to do a this and a this and a this and a this. Well, the client here is ching. And the vet's not thinking that. Right. They're thinking, what can I do medically to offer you the best stuff to get the answer for your pet and then start treatment? Yeah. So that needs to go away. That needs to go away.
Yeah, I think that, and I want to keep going, but the diagnosis, I think the misconception is we're magicians, right? Because you're a vet and you've done this, you just know what's going on with my animal. False. It's like driving in a car with paint on the windshield and you refuse to stop, to pull over, to open it up, and then set up a navigation to know where I'm going. Those are diagnostics. I don't know. I don't know. You're here for teeth, and all of a sudden you got a heart murmur, and then you have everything else going downhill. Every endocrine is failing, and we never knew. And in your mind, pet owner, my pet's been perfectly healthy all her life. Yeah. And I don't understand. It can't compensate. So I got you, Doc, because we could talk all day on that one. Man, all right. Most preventable mistake you see every week.
It's going to be lack of medical record writing. That's it. I mean, I've reviewed many medical records, right? And the majority are going to be badly written. Not their fault. Maybe they thought they were writing the best record they could at the time. You're seeing 40 appointments a day. Yeah. There's only so much. We do have artificial intelligence scribes now that can help you with the process. Somebody still has to vet that stuff though, make sure it's portraying what actually occurred. But poor medical record is one of my biggest frustrations. And I live virtually. So everything that I see with my doctors, it's all in writing. Yeah. So when I audit cases, when I go through the onboarding process, when I check in with them, almost always I have to comment on their medical records. Yeah. Why do I think this medical record is lacking? Yeah. And they're not being malice, they're not hiding something, but they're not seeing it from the viewpoint of a medical board complaint, from a lawsuit. They're not seeing it from that. They're seeing it, oh, well, that's what went down. I just got to summarize what happened. Well, you didn't write down that so-and-so was that the client saying this. How come it's not written down? Well, they did say that, but I didn't think. You didn't think. You didn't think it was important to put that in there, huh? You didn't put in there that you thought the client was actually drunk during that session. You don't think that's important to know? Yeah. They're slurring their words. Something's really, that's important stuff. Yeah, it's not medical. Yeah. I get it. That shouldn't be your job to document, but it is.
But it's part of the case and why things went the way they did. You were inebriated. Your compliance wasn't there because of a substance. And I got to at least say that. Yep. I've had clients, hey, what do you get into? Oh, he got my cocaine. You going to treat him? I'll finish my cocaine. I'll be back. How long you need him for, right? And that's like, oh, at least you were honest. We were going to drug test anyway. Yeah. But Thank
Yeah.
you, because he's cooking right now. So
I want them to document these things,
Yeah.
document everything. Just because you don't think it's important at the time doesn't mean six years from now, when it's a medical board case, it's going to be important then.
That's right.
To document it. If it's not written down, it didn't happen, and then I can't protect you.
Now, on the prevention side, what is something for the pet owner that you see could be prevented every day, every week? What are you seeing on their side? Preventable things.
Oh, I mean, it's easy to correlate that with like not pursuing vaccinations, heartworm preventive, flea and tick prevention.
Yeah.
These things are all, easy.
Yeah.
They're affordable. Every vet can do these things. Why wouldn't you? Why wouldn't you?
Yeah.
And it's back to the whole buying a Ferrari versus not. Like you know what you signed up for, right? When you bought this animal.
Yeah.
So why aren't you following through with all these preventative measures? What are you doing there? Stop thinking that you know best. You don't. You don't. If you did, you would have went to vet school and got a degree. And by all means, go ahead and pursue it. We need more vets. But come on, follow through with the basic compliance that veterinarians are asking for.
Yeah.
That's routine stuff, and it's going to save you a mountain of headache later on, not just financially, but also for your pet's well-being. You're preventing preventable things.
Yeah.
You go to the gym and work out, so you don't get sick later from not being athletic, being active. Do it now. It's gonna help your health and well-being for as long as you have.
That's right. I love that. Last one, Doc. One sentence every pet parent should understand before their next vet visit. I will comply.
Yeah, I know. That's where my mind went. Yeah. Do what the vet says. One sentence. Say it again. Say it one more time.
What's one sentence every pet parent should understand before their next veterinary visit?
They should understand, if I had to sum up everything that we've talked about today, they need to understand the veterinarian is wearing multiple hats, juggling multiple things, and trying and giving you 110% of their attention when they're in that exam room with you, and they only have your pet's well-being in mind.
Love it.
Appreciate that.
Hey, listen. Well said, Doc. We talked about a lot. Hopefully, you guys can digest some of this information. We're here to help because it's important and we see it all the time. But to conclude, this is Prosperity in Practice, Doc. I appreciate you.
Thank you.
If this conversation sharpened your perspective, please share it with someone who loves pets, works in veterinary medicine, or even needs just a better lens on both. That's how we build prosperity in practice. I'm Dr. Owens, Dr. Ireifej, board certified.
Thank you,
Dr.
Doc.
Shadi, I appreciate you for coming, and we'll do this again sometime for sure.
Yes, sir. I look forward to it. Thank you, sir.
Likewise.
Pleasure.
Man.